Many of us have experienced unexpected swelling. Subscribe now so you don't miss anything. But does swelling always mean your lymphatic system isn't working properly? This episode explores the different causes of this symptom, from simple fluid retention to lymphedema. We'll help you understand when to be concerned and what to do. Welcome to New Pod. A swelling, whether it appears suddenly, persists, or keeps coming back, can raise many questions and sometimes cause real concern. Is it a serious sign? Should you be worried, or just wait for it to go away? Very often, the first thing people think of is a lymphatic circulation issue, or more commonly, simple water retention. It's precisely this uncertainty, this search for an explanation, or the hope of a quick fix, that leads many to look into approaches like lymphatic drainage. Imagine someone who, faced with an unexplained swelling, makes the informed choice to consult a qualified health professional to understand the root cause of their symptom, rather than rushing to book a massage. This proactive step is absolutely essential because swelling is never a diagnosis in itself. It's a signal from your body. So, it's crucial to identify its underlying cause before taking any action to ensure truly appropriate and effective care. To fully understand swelling, it's essential to know it can have many different causes. Edema, a general term for an abnormal buildup of fluid in tissues, is a sign, not a disease itself. It can point to a wide range of underlying issues. Among the most common causes are venous issues, which are related to poor blood circulation in the veins, or cardiac problems, when the heart isn't pumping effectively. Kidneys, if they're not working correctly, can also lead to swelling, as can certain medications. Local or general inflammation can also cause this condition. Lymphedema, on the other hand, is a specific type of edema marked by a buildup of lymph fluid due to an insufficient lymphatic system. It's important not to mistake all types of swelling for simple water retention or to blame vague symptoms on an accumulation of toxins, because each cause requires a specific and informed diagnostic and therapeutic approach. It's really important to remember that swelling is primarily an observable clinical sign, not a definitive diagnosis on its own. Its presence clearly shows that something is happening in the body, but it doesn't directly tell us the underlying cause. Specific clinical clues, gathered by a healthcare professional, can strongly guide the investigation. But these clues can never lead to a reliable and safe self-diagnosis. That's why a thorough medical evaluation is always highly recommended to pinpoint the precise origin and exact nature of the swelling. It's essential to clearly distinguish between what's a normal, temporary bodily process, what requires a thorough clinical diagnosis and additional tests, what's a scientifically validated treatment option, and finally, what remains uncertain, is still under research or heavily depends on each patient's unique situation. This careful and tailored approach is the only way to avoid quick assumptions and ensure truly informed, personalized care, moving beyond common misconceptions. Manual lymphatic drainage, often mentioned for swelling, holds a specific place in patient care. It's important to clarify that it's a potential tool, not a universal solution. For diagnosed lymphedema, it's usually considered part of a comprehensive management plan. This complete approach often includes compression using bandages or special garments, regular and appropriate physical movement, diligent skincare, and patient education about their condition. It's crucial never to promise a cure, fat loss, detoxification, or a lasting guaranteed result from drainage alone. Current studies suggest that manual drainage by itself hasn't consistently shown an effect on reducing lymphedema volume. It's also not recommended as a routine prevention after breast cancer. Its relevance always depends on an accurate diagnosis and thoughtful integration. Before considering any intervention, including drainage, it's essential to have a medical diagnosis. Patient safety is paramount. Certain warning signs should trigger a quick medical consultation and immediate suspension of any massage. These include warm, painful redness, the presence of a fever or swelling that appears suddenly or is on one side only. Similarly, chest pain, general discomfort, or unusual shortness of breath are symptoms requiring urgent medical help. It's crucial to avoid attempting any therapeutic technique without a professional assessment. Contraindications and precautions vary greatly depending on a person's general health, the body area involved, and the medical context, especially if it's postoperative or oncology-related. Caution is essential to prevent any complications. If you're dealing with swelling, a few simple steps can really help make your doctor's visit smoother and improve your conversations with healthcare professionals. It's a good idea to note exactly when the symptom started and how it has changed over time. Also, prepare a list of your medical history, any current treatments you're on, and all the questions you want to ask. During your appointment, don't hesitate to ask for a clear diagnosis and what the measurable goal of the proposed care or treatment is. You also have the right to check the qualifications of your healthcare provider or therapist. Finally, instead of just continuing a treatment out of habit, take the time to regularly reevaluate its usefulness and its real effects on your condition. This proactive approach will help you be an informed participant in your own healthcare. In summary, manual lymphatic drainage can be a valuable therapeutic tool. However, its effectiveness relies entirely on an accurate and thorough medical diagnosis. It's not a universal solution, but rather a potential and often crucial part of a comprehensive, individualized treatment plan. This approach requires realistic goals set in consultation with healthcare professionals. It must also be tailored to each individual situation. Understanding the exact cause of your swelling is the essential first step. This leads to effective, safe, and lasting health management. In our next episode, we'll explore a specific aspect of this topic, primary lymphedema. We'll discuss it in detail to continue clarifying and demystifying these complex, often misunderstood conditions. Understanding your body's signals is a crucial step toward better health. We'll keep exploring these important topics to help you stay informed. Subscribe to New Pod so you don't miss any of our upcoming episodes.